to KwaZulu-Natal. The province is hosting this year's World AIDS Day commemoration under the theme, Let Communities Lead. Some community-based organizations have expressed concern and dissatisfaction with how nurses treat people living with HIV at clinics. They say people living with HIV often default from taking treatment because of fear of victimization at clinics. For more on this, we speak to Newzroom Afrika's Ntando Mnyandu, who is attending the event at Mandeni in KwaZulu-Natal. Ntando, where are we in the program at this hour?
Well, thank you very much, Duduzile. The program is slowly drawing to a point where the Deputy President of the country, Mr. Paul Mashatile, will take to the podium and deliver a keynote address. Currently, it is the ambassador of USA or America to South Africa who's on the podium. But we are coming to you live from Kwangete Omhlophe, which is a stadium inside Sundumbili Township in Mandeni under Ilembe District Municipality. What has been happening here since the beginning of the program? We've seen quite a number of non-governmental organizations and community-based organizations protesting inside this stadium, just to ventilate a number of issues. And we've been able to speak to some of them, but the real problem is that people who are on treatment, they find victimization whenever they go to clinics to go and collect their medication. And to tell us more about that, I'm now joined by Sakile Kaba, who is the provincial coordinator for people living with HIV here in KwaZulu-Natal. Babu Kaba, you are saying that people will end up defaulting from taking medication at the fear of victimization whenever they go to clinics. What is the situation on the ground in clinics?
Thank you for giving me this opportunity. The issue, normally the situation that we find where people are defaulting, maybe when they miss or skip 1 month of not going to the clinic to collect their medication, is that when they go to the facilities and then the nurses, they tell them to wait and at the back of the queue for a long time. Maybe they give, if the patient has arrived at the facility at 7 o'clock in the morning, but the patient will be told that they will be attended at 2 or 3 in the afternoon, just as a form of punishment for not coming to the facility the previous month. So that is a challenge that we are currently facing in facilities. Also, another challenge that we are facing is that in government facilities, you'll find that when you visit, in the last month, your file was found, but now you go to the following month, or whenever you visit the next time, then your file is nowhere to be found. So there are lots of patients who complain that their files go missing from the facility. At the end of the day, then the nurses have to start again, redo the file. So and then now they have a challenge of not following what the patient's medical charter is, so that whatever diagnosis that there was previously, and then what's the next procedure was supposed to be. So that is the current challenge we're having at the facilities.
Yeah. But then why are your patients not, going to collect medication on time?
Well, the problem is in South Africa, we have so many social issues. Maybe you'll find that the person was not around within the community during that month. Maybe they went to visit their families or they were not around. But sometimes you'll find that people don't have money to go to the facility. So whenever they find money, then they go to the facility, but then they get punished. So in South Africa, we still have a challenge of poverty that the government of South Africa still need to look at. And our request is that if people are given more treatment so that they could stay at home for a long months, so that people can take their treatment until their time, then when they have money, then they can come to the facility.
Thank you very much, Sakile.
Thank you.
Well, that is Sakile Klaba, the provincial organizer of people living with HIV here in the province of KwaZulu-Natal. But to get the real understanding, let me speak to Phakama Bidla, who's living with HIV proudly so, and she experiences the very same problems that whenever they would go to a clinic, they would find victimization from nurses. Siswam, yini efika yenzeke manifika emakliniki enithi nizola ndimshanguzo yenu?
Ndibulise mina igama lami ndinguPhakama Bidla, ndiphila positive negciwane lengculaza. I-challenge esibanayo ekliniki Okokuqala amanesi ayasithethisa mangaba mhlawumbe ungalandanga i-treatment yakho nge-date kuthi uhlala emva awuzuyithatha i-treatment awuzuyithatha masekushayisa i-treatment awuzuyithatha ngoku. Okunye sengilandiwe ke ngoku into idala basibaleke futhi ukaya eklinikhi ukuthi uthi sowufikile eklinikhi uhlaliswe emva njalo sowungena emanesini natsho noba yina ayithandayo uhlale treatment yakho uthole sekusemalanga awusenayo transport yokugoduka awusenayo imali mhlawumbe kufuneka kube nemali special ukuthi uqhola imoto esuka ezokubeka ekudeni uphinde usuke lapho ekufutshane lapho nekhaya lakho. So amanesi akasiphathi kakuhle kakhulu emakliniki wethu masolanda treatment. Siyacela ukuthi basiphathe kahle basithithise okwabantu bangathi thina si-proud ngokuthi siphila nengculaza. We are not proud ukuthi siphila nayo isimo sasifikele mabeyeke usihlambalaza.
Thank you very much, Siswami.
Ngiyabonga bhuti.
Well, Phakamile Bidla is saying that it would happen that, a date for them to go and collect medication would find them not in the vicinity of the clinic that they would normally go and collect medication from. And whenever they go to those clinics, then they will be victimized by health professionals, particularly nurses, who will then make them to join the queue from the back. Even if they arrived early at the community health care center, they are saying that something needs to be done with how nurses treat them when they go to collect their medication, as most of them end up defaulting, not because they want to default, but because they are scared of victimization each time they go to clinics. The program is at advanced stage now. We will see the Deputy President delivering the keynote address any minute from now, but with that, it's back to you in studio.
Ntando Mnyandu coming to us from Mandeni in KwaZulu-Natal. Thank you very much for that report. And as soon as the Deputy President takes to the podium, we'll hopefully bring that live to you.